Welcome back. When a medical emergency happens, every second counts. And now a new guide is being used in the medical field, created by a local RN and paramedic to speed up emergency care for pediatric patients. Here's Wendy Kushel with tonight's Health Watch.
The Broslow tape is a guide used in ambulances and emergency rooms to figure out what medication dosages to give to children. But Aurora BayCare registered nurse Rick Huston and Ashwaubenon paramedic Mike Haynes didn't like certain aspects of it, so they created their own.
It started out with just a bunch of spreadsheets stapled together, taped to the wall of our ambulance.
Now the Huston-Haynes Pediatric Resuscitation Guide is catching on.
And as a result, it's been used all across Brown County, all across northeast Wisconsin here. And most of the rescue squads and many of the hospitals are using it.
Including Aurora BayCare. It's in all its emergency room crash carts. Here's how the Broslow tape and Huston-Haynes guide differ.
Well, basically, we made it an 8.5 by 11 format, so the text is a little bit bigger. And we put all the information we would need on one page.
With the Broslow, you have to flip back and forth to get dosage info. And
the one thing we have that the other ones don't seem to have is that when it comes to little kids, when they get to be really little, the drugs are all weight-based, so very, very tiny amounts of drug. We've got the actual formulas figured out.
Having already done the math for you, Mike Haynes gives an example.
At 2 o'clock in the morning, you have a child who has some medical emergency. And the parent, you ask your parents how much that child weighs. So we say, well, they weigh 22 pounds. All right, now you have to convert 22 pounds into kilograms because all the medications are given in kilograms.
Let's say the child needs the drug epinephrine.
So now you need to know how much is in the syringe, how many milligrams of epinephrine in the syringe in milliliters.
Sounds like a lot of room for error.
There is quite a bit of room for error, and not so much room for just try to figure out the calculations in time.
Their end goal, that it's easier to use with fewer calculations, giving emergency workers more time to care for the patient. That's Health Watch. I'm Wendy Kushel, Local 5 News HD.
Thanks, Wendy. And to learn how you can get the Huston-Haynes guide, you can call Aurora BayCare at the number on your screen or email them at healthwatch@aurorabaycare.com.